Hi, my name is Aurora, and I'm here to talk about the hyperbaric oxygen chamber, otherwise known as HBOT, and why this could be a really great recovery step for you. So the hyperbaric oxygen chamber is a medical device equipment that allows you to breathe in 99% pure oxygen. With this permits a faster recovery process, allowing your swelling and all other adverse effects to reduce significantly. But before we can even get you inside the HBOT, we have to verify whether or not you're a good candidate for it. So a few things that we want to keep in mind before getting you inside is your medical history: lung disease, collapsed lung, history of ear or sinus surgery, heart disease, history of seizures or epilepsy, diabetes, claustrophobia, upper respiratory infection, if you're currently pregnant, currently taking chemotherapy or cancer treatments, any implanted medical devices, outside of your current surgery, any other open wounds, or any infections. If we're all good on that forefront, that's awesome. We're able to proceed to step 2, which is what you can versus can't do before going inside the HBOT. This includes making sure that you are not wearing any oils, lotions, perfumes, or makeup to the session, ensuring you're wearing 100% pure cotton clothing that is free of static and synthetic fibers, removing all jewelry, watches, and electronic devices, as well as avoiding alcohol, caffeine, and carbonated beverages prior to the session. Other things to keep a note of is you want to make sure you have no fresh tattoos, piercings, hair extensions, or nail enhancements, as these are all would be considered flammable. But otherwise, you would be awesome. So now that we have established whether or not you're a good candidate, we will now talk about how the HBOT feels. First, you want to make sure you have removed your shoes. Secondly, you want to make sure that you're being very careful to where you're stepping. The HBOT is going to be a little bit more of a tinier environment, so if anything, you want to make sure that you are not touching any of the seals. You're stepping very carefully into it and making sure that you're crouching fully under it, so that way you're not butting your head, because it is very, very low. Otherwise, however, you should be all set. In the HBOT machine, we do have a recliner option, so that way you can be comfortable throughout your entire journey. Now, the HBOT is not going to have any sort of weird symptoms or anything like that. However, you will experience some ear pressure. I like to explain it as the same as you would feel as if though you're going to descend from an airplane. You have that same sort of ear pressure. It shouldn't be anything too uncomfortable, but it should still feel a little awkward, if you will. Otherwise, however, you will feel completely all right. Stepping out, you're going to follow a very similar protocol. You're going to carefully situate yourself out by removing the oxygen mask and watching your head as you start to lean forward and head outside the HBOT. But again, I do want to preface that you want to make sure you are not stepping onto the ceiling itself for your own safety. Once you step out of the HBOT, you may feel a little lightheaded. That's completely normal. A nurse will oftentimes check in with you afterwards to ensure that you are doing okay.